She is a caretaker who feeds roughly 10 cats in front of her house. She's been doing this for years. She spay-neutered them all. Whenever they are sick, she takes them to the vet. She is very responsible. When COVID hit, she lost her job. So she was unable to feed her cats, and she contacted us and asked if she can bring all 10 cats to our shelter so that we could rehome them. Again, do these cats really need rehoming?
No, they had a safe area to live. They had someone who took care of them. The only thing they didn't have for a short period of time was food supply. So we provided food to the lady for a couple of months until she finally had a job again. She stopped taking our food supply and started taking care of the cats on her own again. Here too, the cats were able to stay in their safe area where they lived. The caretaker was happy, and we saved space for 10 other animals in the shelter simply by providing a little bit of food. Behavior health support. So especially when it comes to dogs, a lot of dogs get surrendered into shelters because of behavior problems. This could be biting, house soiling, destructive behavior. Do we want these dogs in our shelter? No, it is very difficult to adopt out a dog that bites people. At the same time, it is also very difficult in a shelter setting to rehabilitate this dog, to get it ready for adoption so it's not dangerous for the community. When we talk to owners, a lot of people actually do not want to surrender their own pets. What they really want is help, but because they ran out of options, the only way they think they can help is by surrendering their pet. So here again, I have an example. Bella, a dog that I was recently contacted about. The owner loves Bella. But Bella recently started attacking people in front of her house. The owner didn't know what else to do. She asked us to take in this dog and rehome it. And when I asked her, so if Bella would stop biting, would you keep her? And she said, yes, of course. So now we're working with Bella with behavior modification training, trying to assure that Bella stops biting so that she can stay in her own home. The owner will be happy. And again, we have space in our shelter for a dog that needs us more. Temporary housing support. So this is technically shelter intake, but it does not burden the adoption program. That's why I've put it in there. So again, I have an example. An owner with 5 cats became really ill and went to the ICU. Her sister contacted us and said, there is no one that can take care of these cats if we can get them into our rehoming program. We discussed with the sister that we can take the cats for now, temporary homing, and once the owner feels better, the owner can take the cats back from us. Unfortunately, the owner did pass away, so we talked to the sister, and she actually discussed it with her family, and they found a family member that said they would be able to take the 5 cats. So by temporarily housing these animals, we were actually able to get them back into the family once the family crisis was over. And again, we were able to save 5 spaces in our shelter for other animals that didn't have that kind of home to get back to. Oh, sorry. Okay, then the second category of programs is community dog and cat programs. Here I mostly want to focus on trap, neuter, vaccinate, return. I also added treat in here, because a lot of animals that are sick or injured, once they are treated, they don't need to stay in the shelter system either. They also can go back into their communities. So these kind of programs are important in 2 different ways. For one, the spay-neuter part. Obviously, the more spay-neuter we do in selected communities, the more we can control overpopulation, and ultimately at some point we have less shelter intake, therefore less burden on our shelter housing. The second importance here for these kind of programs is the return part. a lot of animals can return. Even if you have an animal that comes in from a community that needs to be hospitalized for a couple of weeks, a lot of them are fine after treatment and can go back home. So that too will avoid unnecessarily filling up the shelters with animals that don't necessarily need to be there. Okay, the third category, managed intake. So do we really need to take every animal into our shelter right away? Or are there possibly some other options and solutions sometimes? Again, example, something that happens to us, to our shelter every single day. We get a message, I found a kitten, I cannot keep it, can you take it? Every day, several times a day. Our shelter does not have the capacity to take care of so many young animals. And in general, we do not have the capacity to take care of all these intake requests. So what we usually do with these people, with these rescuers, we tell them, hold on. Yes, we understand you cannot commit for the next 15 years, but could you possibly commit for the next couple of weeks? And guess what? Most of people say yes, they can. So while this animal is taken care of by the rescuer, we then try to find a more permanent solution with this animal together with the rescuer. A lot of them end up adopting themselves, problem solved, or they find friends or family that might want to take this animal. For those that don't find a permanent solution, we then schedule intake when we have space available. So if we have a lot of animals in the shelter, maybe that kitten or that puppy can wait another 1 or 2 weeks until we have more space available again. Ideally, we wait until these animals are vaccinated so that this shelter population is more likely to stay healthy and the intake stays healthy as well. So to summarize, through these kind of pre-sheltering programs, shelters essentially become a community resource center that engages with their community and helps their community rather than an isolated island where they simply house animals and are completely blocked from their community. So if you remember, our ultimate goal from the beginning is to save lives. Ideally, as many lives as possible. Through pre-sheltering programs, we can help many animals because we don't have to shelter them all. A shelter can only help a limited number of animals, but a community can help so many more animals. And that's it. Thank you so much.
Thank you, Ms. Martina. Anybody would like to pose a question or two before we move on to the next speaker? Yeah, go ahead, sir. There's a microphone there if you wish to use it.
Thank you so much, Martina. My name is Dr. Op from Sarawak, Thailand. And totally agree everything that your presentation because we made the same problem across of Thailand about the not standard of the animal welfare shelter. A lot of the local shelter in the Thailand, but the Thailand government is still have the strategy to building the shelter and go ahead for the strategy to control population and in the way that bring them to the shelter. Every time I need to convince them to change strategy to use the TNMR or CNVR program to be the pre-sheltering process. But then sometimes they not understand really what kind of the standard shelter has to be. And please suggest me to how I can explain to them how to start to them to understand about this problem. Thank you.
That's usually a very difficult problem. I think sometimes what happens is that we in animal welfare, when we have these discussions with relevant stakeholders, we very much focus on the animal welfare aspect. And we often forget that there are lots of people out there that don't care. Right? So instead of coming from this perspective of animal welfare, I think we need to think more about their goals and what they are really interested in. For example, they don't want dog or cat populations on the street. So how can we convince them that the kind of programs that we want to do are actually more beneficial than the programs they are currently doing? Another thing I noticed in general with these kind of discussions, we ourselves don't make a lot of effort or enough effort to provide the kind of data that is necessary to convince someone. Because if we just have a meeting and tell them, please do it differently, that's very difficult. Why should they change their mind? Why should our way be better than their way? But if you make the proper preparations, you collect your data, you have a good presentation, you understand the percentages, the ratios of different programs, and you then present that in a very simple and easy way, maybe they see the benefit. Maybe through that program, they will actually see that X amount of money can be saved. For example, that's something that they might possibly be interested in, right? Saving money rather than animal welfare. So I think we with these kind of conversations, we need to get out of this idea we want to improve animal welfare, and rather, how can we convince these people? What kind of incentives do they need to actually create that kind of change? Yeah.
Thank you so much.
Any more questions from the floor? All right, I guess thank you, Ms. Mayr.